When it comes to planning for retirement, healthcare is one of the biggest unknowns. You might have a great plan for your investments and living expenses, but medical costs can really throw a wrench into even the most best laid plans. So how can you prepare for something that is so hard to predict? Well, in today's video, we're going to dive into the reality of healthcare costs in retirement. What factors impact those costs? And more importantly, practical strategies to help you plan for them. Whether you're just starting to think about retirement or you're already retired, understanding healthcare costs is something that's essential to protecting your financial future. Healthcare costs are one of the biggest expenses that retirees face, and they can be very unpredictable. According to recent studies, a 65-year-old couple retiring today may need close to $300,000 just to cover healthcare expenses in retirement. And that doesn't include the potential need for long-term care, which can add even more expense. The reason healthcare is so costly in retirement comes down to a few key factors. People are living longer, medical costs are rising, and Medicare doesn't pay for everything. As we age, we're more likely to need medications, treatments, and potentially even long-term care, and all of these things really add up. Let's start by looking at Medicare. Medicare is the primary healthcare coverage for most retirees, but it's important to know what it covers and what it won't cover. Medicare has 4 parts, A, B, C, and D, and Part A is hospital insurance. It generally covers inpatient hospital stays, skilled nursing care, and some home health care services. The good news is that it's typically premium free if you paid Medicare taxes while you were working. Part B covers outpatient services like doctor visits and some preventative care and some therapies. There's a monthly premium for Part B, which can range anywhere from $150 and up, depending on what your income is. Part C, also known as Medicare Advantage, is an alternative to traditional Medicare, and it often includes additional services like vision and dental, and it may limit the out-of-pocket costs for you. However, typically it has some network restrictions, so it's really important to review the plan details. Finally, Part D covers prescription drugs, which can be a significant cost for many retirees. Each Part D plan is a little different, so you want to look for the one that best matches the medications that you need. While Medicare is a solid foundation, it doesn't cover everything. For example, it doesn't cover dental, vision, hearing aids, or long-term care. And that's where planning for additional coverage comes in. If you want more comprehensive coverage, you might consider either a Medigap policy or a Medicare Advantage plan. Both can help with out-of-pocket costs, but they don't work exactly the same. Medigap, also known as Medicare Supplement Insurance, is designed to cover some of those costs that the original Medicare doesn't, like co-payments, co-insurance, and deductibles. With Medigap, you have more flexibility to see any doctor who accepts Medicare, but you'll pay a monthly premium on top of your Part B premium. Medicare Advantage plans, on the other hand, are an all-in alternative that includes Parts A, B, and often Part D. These plans usually have lower premiums than Medigap, but may restrict you to a network of doctors and hospitals. The choice between Medigap and Medicare Advantage depends on your healthcare needs and how much flexibility you really want to have with your providers. It's worth exploring both options to see which one fits your situation best. Another major expense that Medicare doesn't cover is long-term care, which includes services like nursing home care, assisted living, and home health aides. Long-term care costs can be staggering. For example, a private room at a nursing home can cost you over $100,000 per year. To cover these costs, many people initially consider long-term care insurance. However, due to rising premiums and limited availability, more retirees are turning to other options like hybrid life insurance with long-term care riders or even Medicaid. I'm now going to explain Medicaid's eligibility requirements using my home state of Arizona as an example. Medicaid is an option for covering long-term care, but it usually has strict eligibility requirements, especially in Arizona. Medicaid's long-term care program is administered through ALTCS, the Arizona Long-Term Care System. ALTCS can help cover nursing home care, assisted living, and even some in-home services. However, eligibility requirements are specific and quite strict. To qualify for ALTCS in Arizona, applicants must both meet income and asset limits. Here's how these limits break down. The income limit: As of the latest guidelines, for an individual, the monthly income limit is around $2,742. If your income exceeds this amount, you may need to set up an income-only trust, also known as a Miller Trust, to still qualify. This trust restricts access to excess income so it won't count towards your Medicaid eligibility asset limit. The asset limit. So for a single applicant, the asset limit is generally $2,000 in countable assets. Countable assets include things like cash, bank accounts, stocks, and most retirement accounts. However, some of these assets are exempt, such as your primary home. You're allowed to have equity up to $688,000. You're allowed to have one vehicle and some personal belongings as well. For married couples, if only one spouse needs Medicaid, the other spouse, the community property spouse, or the community spouse can retain a certain amount of the couple's assets. In Arizona, the community spouse resource allowance allows the non-applicant spouse to keep between $29,724 and $148,620 in assets, depending on the couple's resources. If your assets exceed this limit, Arizona allows applicants to spend down excess assets to qualify. This might involve paying off debt, purchasing exempt assets, or making home modifications. However, like other states, Arizona enforces a 5-year look-back period. This means that if you've transferred assets for less than their fair market value within those 5 years of applying, you may still be subject to a penalty period, during which you won't be eligible for ALTCS benefits. The penalty period length is based on the value of the transferred assets and the average cost of long-term care in Arizona. This can result in months or even years of ineligibility, which is why advanced planning is essential if you're considering Medicaid to pay for long-term care. Medicaid as an option for long-term care, if you do qualify, ALTCS can help cover the costs of long-term care in Arizona, including nursing home care, assisted living, and home and community-based services, like in-home health aides and adult daycare. These services can provide essential support for those who prefer to stay in their homes for as long as possible. However, Medicaid doesn't cover everything. ALTCS will generally cover semi-private rooms in nursing homes, but private rooms are only covered if it's medically necessary, and some additional services and amenities like private pay therapies may not be covered. So it's important to really understand the limitations. And another factor to consider is that ALTCS recipients are generally restricted from facilities and providers within the Medicaid network. Some nursing homes have limited Medicaid beds, meaning there could be waiting periods or limited facility options. If you qualify for ALTCS, you may need to contribute part of your monthly income towards your care. This is known as the share of cost requirement, which ALTCS will calculate your monthly contribution based on. ALTCS will calculate your monthly contribution based on your income after deducting allowable expenses such as certain medical costs, a small personal needs allowance. Planning for long-term care is complex, particularly when considering Medicaid and ALTCS eligibility requirements. If Medicaid might be part of your long-term care strategy, it's wise to work with a financial advisor or elder care attorney. They can really help you navigate the rules, improve your eligibility, and support your financial goals. If you'd like to explore how to prepare for healthcare and long-term care costs in retirement, I invite you to schedule a call with me, and together we can review your options and develop a plan that helps to meet your goals and your budget. All you got to do is click the link below. We'll schedule a call and we'll get started. Thanks a lot and have a great day.